Starting off with heat injuries. Before that, we need to know the normal physiological response of body to heat. See, the homeostasis or normal body temperature is 35.6 to 37. Whenever the body temperature increases, the hypothalamus does two things to regulate this increase in body temperature. First is vasodilation. When the hypothalamus causes vasodilation of the blood vessels, let's see, this is our hand, right? So whenever it causes vasodilation of the vessels, more blood goes to the surface skin. So when more blood goes, more heat goes, and heat is dissipated or gone out to the environment. Second is it does sweating. Sweating does a cooling response to decrease the body temperature. So hypothalamus is doing two things. What first is vasodilation and second is sweating. Now, heat related syndromes. What happens when there is excessive temperature outside in the environment? The symptoms progress in these three manners. First one is heat cramps or Meniere's or fireman's cramp. What happens in cramp? See, whenever there is sweating, a lot of sweating, there is a lot of sodium loss, and we know that muscle contraction is related to these ions, right? Sodium, calcium. Whenever those balance will go, there will be there will be excessive muscle contraction, or it is not regulated, so there will be painful muscle spasm. And the core body temperature here is normal. Why? Because hypothalamus is doing sweating, hypothalamus is doing its job of sweating. The core body temperature is it's still normal, but the mechanisms are starting to fail. Now second one is heat syncope. See what happens in syncope. Whenever there is sweating, there is excessive loss of water. So when the water is lost, the blood volume is decreased. Now there is less amount of blood, so now the heart have to pump more, or the heart rate increases, because the heart have to manage in that little amount of blood that should reach every areas. So when the blood volume decreases, less blood goes to the brain. So there is decreased cerebral perfusion, and the blood pressure is also decreased because the blood volume is decreased. This decreased cerebral perfusion will cause dizziness and syncope, and the person will start to faint. Here also you can see that the core body temperature is still normal. The compensatory mechanisms are working. The last is heat stroke, and in this heat stroke, the core body temperature will also increase. The body is no more adapting to these external environmental heat changes. So now heat stroke. Here, how does a heat stroke occur? First thing to see is thermoregulation is impaired. Means hypothalamus is no more doing any vasodilation or sweating. So there is no sweating. So lack of sweating will call excessive lack of lack of sweating except in exertional heat stroke. We'll leave this topic for the next slides. Here just you have to know that there is lack of sweating because hypothalamus has stopped working, thermoregulation is impaired, and there is decreased blood pressure and increased heart rate. Why this increased heart rate? As I told you, that the volume is lost, so the heart has to pump more so that the body parts gets enough amount of blood in that less volume, right? And there is dry skin because there is loss of sweating. So now what is the triad of heat stroke? We know heat stroke occurs when there is impaired thermoregulation. So any history of heat exposure when the core body temperature increases to 40.5 degrees Celsius. Core body temperature has increased because the regulation is lost, and there is CNS dysfunction, blood is not going to the CNS, there is dizziness, etc. Then we can say that the cases of heat stroke. We need three things. What? History, core body temperature increased, and CNS dysfunction. Now whenever there is heat injuries or person who has received a heat stroke, their autopsy shows a one peculiar finding, that there is a post-mortem calorificity. What is post-mortem calorificity? That the body remains warm after some time after death. Why? Normally the body should cool down after death, but here it is remaining long. Why? Because here during this heat stroke, when a person encountered heat stroke when he was alive, the cooling mechanisms have been lost, or cooling mechanisms have reduced their efficiency. So after the death, after the death, the body will be for a longer amount of time because the cooling compensatory mechanisms are gone. So there is warm after a death. Now let's introduce to the burns. These were general features that were happening inside the body whenever there is excess temperature. Burns are specific, that the fire or injury is causing to the specific local area. Now, how much heat is required to cause burns? See, 5 to 6 hours, if there is 45 degrees Celsius, then burns can occur. If the temperature is high, even a 2-second heat fire can cause burns. So causes exposure to dry heat, fire or flame can cause burns. Now classification. First one is Wilson's classification, 3 degree classification. That we are not doing, we are doing the modern classification. See, this is the modern classification of burns. Now how will we classify burns? Burns is classified on the basis of how much of the skin is involved. If the burn has taken a lot amount of skin or it is damaged, then it is third degree, fourth degree, and the minor one which only goes to epidermis, that is first degree. So we'll study this classification in the next slide. See, first just learn the layers of the skin. First is epidermis, second this one is dermis, and these are the dermal appendages that are coming down in the subcutaneous. Last is muscle. So we have epidermis, dermis, dermal appendages, and muscle. So first degree burns just involves the epidermis. Only this much is lost. Second degree we have second degree superficial partial and secondary deep partial, and third and fourth degree. So we have divided secondary into superficial and deep. And why partial? See, because the secondary has epidermis and papillary, or only this much amount of partial dermis. Secondary deep has complete dermis, the entire dermis is involved, and the third has dermal appendages. The first is epidermis, secondary superficial is partial dermis, secondary deep is complete dermis, and the third is dermal appendages. Done. And the fourth, if it goes to the muscles or bone, it is the fourth degree burn. So now what happens when there is initially first second degree burns and the last third fourth degree burns? In the first second degree burns we see redness and blisters. Redness is erythema and these are blisters, and at the end we see charring or blackening of skin. So in this table we have learned these two columns. Now we'll focus on features, pain, scarring and healing. See, in the first degree burn there is erythema, and secondary has erythema and blisters. Third degree has blisters, and as I said that as we go on left side of this, there is charred and blackening of skin as the severity increase. So third degree and fourth degree has charred burns. Now there is pain only in first degree and second degree superficial. Why? Because the nerves here are intact. In when the burns are deep, the nerves are damaged. If the nerve is damaged, there will not be any sensation of pain. So here in second degree deep partial, the burn is so deep that the nerves are also washed away or damaged, so there is no pain. Scarring. In first degree burns there is no scarring, but whenever the dermis will be involved, see in second degree we have the involvement of papillary or upper part of dermis. So whenever there will be dermis involved, there will be scarring. So everywhere there is scarring, but in the last two there is scar formation. What is scar? See, in this image you can see this blackish thing. That is scar. That is advanced stage of scarring or healing. Healing does not occur in these two. There is scar formation, and healing only occurs in the first three. And the healing time also increases. First degree is less than 1 week, second degree 1 to 3 week, and then greater than 3 week. So this was about the degrees of the burn. Now estimation of burnt surface area. See, whenever a patient or any person undergoes burns, how will we describe the severity of burns, right? How much amount of body part is involved? How we just look at the person and say that okay, this person has severe burns and this person has less burns. So how it is described? It is described on the basis of burnt surface area. How will we calculate burn surface area? For this, remember just 9 into 11 equal to 99, means we have to place this 9 times inside the body, and then we just have to place this 1 which will give 100. So we'll start placing 9 first. First is 9% of head and neck on the both sides. So front and back of head and neck gives 9% body surface area. 9 of hands, both the hands, so front and back both 9 of one hand and the second hand. Now for legs we have 9 of the anterior part and 9 of the posterior part, so one leg will have how much? 18. So till now we have done 1 2 3 4 5 6 7 7 nines. Now left is this one, 9 here on the anterior part of the trunk, 9 on the posterior part. Similarly in the abdomen, 9 in the anterior part, 9 in the posterior part. So we have 11 nines and the 1% is for genitalia. Done. So this is the how we calculate the body surface area in the burn. So if a patient undergoes this much amount of burns, let's say this, then you can calculate, okay, the patient is having 30 or 40 burn surface area. Now in the same thing that we give area, we give numbers to the areas, right? So now we'll individually divide here. See, I told you head and neck was 9%, front and back. So front, head and neck will be how much? 4.5. So in that 4.5, 3.5 is head and 1% is neck. In the hands we have 4, 3 and 2. Now the hand was 9% total, front and back. So now 4 is front and back both of this much part, then 3 and 2, so this will give you 9. Now the gluteal region is 2.5 for the front and 2.5 for the back, and the same leg, entire leg is how much? 18. It is divided into 10, 5 and 3, which will give you 18. So this was just a division on just a game with numbers. Now, there is exception in children that the head of the children is comparatively greater than the rest of the body. So, head is 18% in children, while in adult it was just 9%. The lower limb is reduced to 13.5 in children, while the adult is 36%. Now, for children, the best chart to study is Lund and Broder's chart for children less than 15 years. Now, rule of palm, what is it? Let's say the person did not encounter a uniform burn or this much area. Person has a patchy burns. Let's say burn over here, burn over here, burn over here, and burn over here. Now, how will you calculate this? I know that I have given 9 to entire surface area, but here I have to use different rule, which is rule of palm. So here what I will do is, let's say this is the size of a palm, so this much is 1% body surface area, so he has 4 patches in the size of a palm, so he has 4 percentage of burns. So this is rule of palm, which is used in what? Patchy burns. Now see, this is the concept that you have to understand is, whenever a person, let's say this person is in a room which is burning, so he is getting burns all over his body surface. So whenever there is a burn, there is a gas called carbon monoxide. Is carbon monoxide gas is there in this, in that smoke. Now when is, if the person is alive in that room, then this person will breathe this carbon monoxide. This carbon monoxide will go into lung, and from there to alveoli, and from there to blood vessel. So if after this person dies and we check his blood, in his hemoglobin, if there is carbon monoxide or he has a decent amount of carboxyhemoglobin, then this person would have been alive. If this person would have been dead, then he would not be breathing, so this carbon monoxide will not go inside the blood, right? So blood having carboxyhemoglobin is a feature of anti-mortem burning, means the person was alive at the time of burn. So bilateral carboxyhemoglobin, that will study in next slide. Now what are causes of death in burns is divided on the basis of timeline. See, first is instantaneous, how a person can die instantaneous in the presence of burns. So first one, there is laryngeal edema. Here you can see that these vocal cords are swollen, so there is edema in larynx. So now what will happen, the gases cannot come, the oxygen cannot come inside the trachea to the lungs, so the person will die immediately over there due to laryngeal spasm. And why there is laryngeal edema? Laryngeal edema is caused due to the heat of the surrounding. Second is carbon monoxide intoxication. I told you that carbon monoxide is there in the smoke, so if carbon monoxide binds to hemoglobin, then there is no oxygen here, so the body parts will not get oxygen, so this is carbon monoxide intoxication, which will cause instantaneous death. Second is neurogenic pain. See, Whenever there is heat or any stress, sometimes the cardiac signals are decreased. The pain receptors sense this and the cardiac signals are decreased and there is decreased cardiac output and the blood vessels lose their sympathetic tone due to these pain receptors activating. And whenever the cardiac output is decreased, there can be a shock. Means shock means the blood is not going to the brain. Why? Because the cardiac output is decreased. And why that happened? Because of stimulation of the pain receptor. So due to neurogenic shock, the person can die immediately. Now, if the person survives all this, then how a person can die on day one? Day one, due to dehydration, burns has due to burns there is loss of fluid, and due to that there is dehydration, and due to that there is hypovolemic shock because the body is not having that much fluid to give oxygen to the body part. So there is hypovolemic shock. On day 2, hypovolemic shock can lead to acute renal failure. How? The kidney is not getting, let's say the kidney is not getting blood. Why? Because there is less fluid inside the body. Now, if the kidney is not getting blood, then the waste cannot be filtered because you need fluid to flow through the kidney and then waste can be filtered. So the waste are not filtered. Due to that, there is acute renal failure. Right? Now, on the day day more than 3, how? Day more than 3, we have bacterial multiplication in the skin. Why? Because the body surface area is burnt, so the skin is open for the bacteria to grow inside the deep layers, and that will result in sepsis or septicemia. That will occur after day 3. Now, there is a Morgellons ulcer. See, what is Morgellons ulcer? That the burnt surface or the burn scars after many years, this burn scar can result in cancerous outgrowth. Why? Because there is repeated healing, inflammation, scarring, and that can maybe cause mutation and called a Morgellons ulcer. So, malignancy developing in the burn scar after years is called Morgellons ulcer. Now, what are the autopsy findings that tell that the patient was alive before burn or the person was already dead when the burn happened? First and the most important here is crow feet sign. See, whenever we close our eyes, we have these wrinkles over here. So, if this person was alive during the burn, then he would have closed his eyes and the soot or the smoke is not deposited in these layers. So this is crow feet sign and it is a feature of ante-mortem burn or the person was alive at the time of burn. And there is absence of liver, ulcer and rigor mortis. Now we are studying some non-specific findings. What is heat fracture, hematoma, rupture and stiffening? These are non-specific findings that does not only suggest that the person was alive before burn, but these findings are usually present if the person was alive before burns. So first one is heat stiffening. See, we all know that whenever the egg is boiled at some temperature, then there is the white part it hardens. So what is that? It is protein coagulation. So in the same way, when the muscle are exposed to heat greater than 65 degrees Celsius, protein coagulates and there is stiffening of muscle. This is called boxers or pugilistic attitude. In this image you can see. So this is heat stiffening that is caused due to protein coagulation. Now, what is heat rupture? See, due to heat there is drying of skin and that result in splitting of skin and this is heat rupture. Now, how can I be very sure that this is due to heat only? It can also be due to a that a person has injured this person or killed this person via these marks and then burnt him. So how will we differentiate this that this is antemortem or postmortem? No, sorry, not antemortem and postmortem. How will we differentiate that this is due to heat or not due to any weapon? So here we have a peculiar difference that if the injury is caused due to any sharp objects, then he in this image you can see that these are the blood vessels. So whenever a sharp object will cut through, then the blood vessels will get cut over here. So there will be bleeding over here. But in heat due to rupture, the vessels are not cut. So this the floor here is pale. Plus there are no vital reaction because the person is already dead. So we have large, now this heat rupture are on the extensor surface and they are large and irregular. while this cut is regular. See, because the weapon is sharp, so we'll have regular cuts, but here we have irregular cuts and it is on the extensor surface. And there are intake vessels because no vessels are getting ruptured over here. Now another finding, let's say a dead body is brought to the PM room and the case is of burns. We are watching that the all of the body surface is burned. Now we open the cranial cavity and in this we find the clotted blood. So this clotted blood can also due to the trauma. So let's say if the person was killed by a rod hitting on his head and that resulted in trauma, after that they burned the person. This can also be the reason. So how will we say that this clotted blood inside his brain is not due to trauma but it is due to heat or the burn that has caused this trauma? So how will we differentiate it? For that we have to learn the concept called heat hematoma. See, what is heat hematoma? That these are the, let's say these are the layers of the brain and this is the brain and these are the meninges of the brain. So whenever this person encounters a heat or he is burnt, there is a loss of water that will cause the atrophy of the brain. So whenever this brain gets atrophied, so this blood vessel that is in between those layers, they will lose their support. So this brain goes atrophies and goes down, the blood vessel lose their support and they rupture, and that will lead to hematoma. So this hematoma or the clotted blood is due to this reason. The brain gets atrophied, blood vessel lose their support, and the blood comes out of that blood vessel as they break because the support is lost. Right? So that is what called heat hematoma. Pathogenesis, as I explained, that hematoma in the epidural space due to rupture of emissary veins and dural venous sinus. Why these veins are ruptured? Because the space is lost and the support is lost. Now there is a thing that differentiates this from epidural hemorrhage or any traumatic injury. This traumatic injury also causes this clotted blood inside the brain. So there is one thing that differentiates it. That thing is carboxyhemoglobin in blood clot. As I already explained that if there is carbon monoxide in the hemoglobin structure or carboxyhemoglobin, then the person was alive at the time of burn. So he has taken in that carbon dioxide during respiration. Now second is chocolate brown color and honeycomb appearance and chocolate brown color. How this happens? See, let's say this is the layer of the skull. So now the vessel has ruptured and there is bleeding over here. So now due to intense heat, this blood is like boiled. That much amount of it, that is blood is heated and boiled, that will change the color to chocolate brown. So we have chocolate brown color, first thing. Second thing, honeycomb appearance. Why honeycomb appearance? Because when the blood is boiled, there are bubbles and that bubbles are trapped inside the clotted blood. When those bubbles here will be trapped inside the clotted blood, there will be honeycomb appearance like this. So we have chocolate brown color and honeycomb appearance. And this is universal fact that whenever see carbon monoxide is seen in the blood, then the person was breathing at that time, right? Now, heat fracture. Heat fracture is caused due to drying of bone. See, when the skin gets dried, it causes heat rupture. When bone gets dried, they got heat fracture and charring of the bone. In skull, you see spider web fracture, and the long bones have street and avenue fracture. Now, antemortem burns. What are the external findings that suggest that it was antemortem burn? See, if it was an antemortem burn, or the person was alive before burn, then there will be healing and inflammation. Why healing? Because the body treats burn as a foreign body. Like if the body is encounter foreign body, then body will send WBCs and everything over there, and that is inflammatory reaction. So that blisters will be rich in protein. What are proteins? WBC, mast cell, etc. Blisters are rich in protein and chloride, increase enzyme, signs of inflammation or healing, which is granulation tissue and red line or repair. Everything is basics of inflammation from pathology. Just you have to understand this, that the body treats burn as a foreign substance, and if the person was alive, then there will be all these reactions. Now, antemortem burn internal findings. As I told you, if the person was alive, then he would be breathing, and then this carbon or soot deposit, the smoke will go deep inside the lung in the trachea or the in the terminal bronchiole. So inhalation of the smoke. Second is, this one I already taught you, that carboxyhemoglobin and cyanide, how it goes in the blood. Person is breathing, and then both cyanide and carboxyhemoglobin or carbon monoxide from the smoke goes inside the lungs. Last one is curdling ulcer. See, what are curdling ulcer? Whenever there is burn, there is loss of fluid, right? The fluid gets evaporated. So the body does is, what the body does is, body knows brain is more important than any organ. So what the body will do is, it will divert blood from everywhere. Non-essential organs like the stomach, eye, liver, from there the brain will divert, sorry, from there the body will divert their blood so the brain can get maximum blood. So when the blood goes away from the stomach, or there is vasoconstriction in the vessels that supply the stomach, there will be stress ulcer because there is less fluid. So this will cause stress ulcer or curling ulcer. This also suggests that it is antemortem burn. Why? If the person is alive, then only these compensatory mechanisms will work. Now, burns versus scalds. See, what are scalds? Scalds are injury due to hot liquid. Hot liquid. In burns, we know there is charring and singeing of hair. The hair gets dried up. So charring is seen in burns while it is not seen in liquid. Now, what happens in scalds is, whenever, let's say, the hot fluid flows over this epidermis, then due to the heat of this fluid, it get absorbed, or the skin layers takes up that fluid. So there is swelling over here. You can see this swelling, and this fluid also dissolves away some of the pigments. So there is bleaching of the skin, or there is pale appearance. Why? Because the pigment that was giving colors to the skin, they were all washed away by this fluid. So there is absorption of fluid, which is shortening and the bleaching of the skin. Now, third one is line of blisters. Line of blisters is seen in burns. Why? Because the fluid, it flows like this in line. So we have line of blisters in the scalds. Now another thing is splashing. What is splashing? When water doesn't get concentrated in this area, right? When a water falls, it falls drop by drop in different places. So that is splashing, which is seen in scalds, not in burns, because there's no water in burns. Now clothing are burnt in burns and intact or wet in scalds. Level of contact, because the fire that rises above, so it has at or above the level of contact, and water goes down, so it is below the level of contact.